Hey there, and welcome back to the Smarternuthub podcast. Today, we're diving deep into the real stats on long-term weight loss while on weight loss medications like Ozempic, Wegovy, Mounjaro, and Zepbound. Whether you're already taking semaglutide or tirzepatide, thinking about starting, or just curious about what real-world results actually look like, this episode is for you, and I'm going to share some really encouraging findings from the latest real-world research that might surprise you. This episode is about giving you the information you need so you have total control over your future health. So, here's what we know. You've probably heard the headlines. Clinical trials show that Wegovy can help people lose about 15% of their body weight. Mounjaro and Zepbound, even more impressive, at around 21%. Those are the numbers that get everyone excited. But here's the question nobody really talks about. What happens in the real world? When you're not in a carefully controlled clinical trial, when you're juggling work and family and insurance hassles and side effects, what kind of results can you actually expect? Well, we finally have answers, and they're a mixed bag, but honestly, more hopeful than you might think. Let me share what the latest research from 2025 shows us. Cleveland Clinic studied nearly 8,000 real patients taking these medications. And here's what they found. On average, people lost about 8.7% of their body weight after 1 year. Now, that's about half of what the clinical trials promised. But before you get discouraged, let me tell you why this number is actually really interesting. The people who stayed on semaglutide for the full year and reached the high maintenance dose, they lost 13.7% of their weight. The folks on tirzepatide who stuck with it, 18% weight loss. Those numbers are right in line with the clinical trials. So the medication works. The real challenge, it's not the drug, it's everything else. And that brings me to something really important. Around this point in your journey, whether you've just started or you're a few months in, you might be wondering, am I doing this right? How do I make sure I'm one of the success stories? That's exactly why I created a free resource for you. It was a success checklist for weight loss medications, but turned into an ebook. But it covers all the dietary strategies, lifestyle habits, and practical tips that can help you keep the weight off long term. You'll find the link in the description and pinned comment if you want to grab it. It's completely free, and I also have a free menu plan which you can also grab. I'll link that for you as well. Okay, so let's talk about why there's this gap between what happens in clinical trials and what happens in real life. The biggest reason, nearly half of people stop taking these medications within the first year. And I'm not talking about people who just give up. The number one reason people discontinue is cost and insurance barriers. These medications can cost over $1,000 a month without insurance coverage. That's not sustainable for most families. Side effects are another big factor. The nausea, the stomach issues, the fatigue. For some people, it's manageable. For others, it's just too much. And during the shortage periods we've seen, people couldn't even get their prescriptions filled. Here's another interesting finding. Over 80% of people in the real world are using lower doses than what was tested in the clinical trials. Maybe their doctor started them low and never increased it. Maybe they couldn't tolerate the higher doses. Or maybe insurance only covers the lower strength. If you've watched any of my videos, you already know I'm one of these patients. I started on a microdose due to cost and a couple of other reasons. It has worked out well for me, but apparently some others haven't had the same success. So who are the people getting those clinical trial level results? The research shows some clear patterns. First, the people who don't discontinue early. If you can push through those first few months, get your body adjusted and stay consistent, your chances of success go way up. Second, people on the higher maintenance doses tend to lose more weight. That makes sense, right? But it means you need to work with your doctor to find the highest dose you can tolerate. Third, tirzepatide users, on average, lose more weight than semaglutide users. We're talking about 12.4% versus 7.7% in the real-world data. Both work, but if you have the choice and can afford it, tirzepatide seems to have an edge. And here's something interesting. Women tend to have slightly better outcomes than men in the studies. Nobody's entirely sure why, but it's consistent across multiple research papers. Now, let's talk about something that doesn't get enough attention: muscle loss. One of the big concerns that came out in late 2024 and 2025 is that when you lose weight on these medications, you're not just losing fat, you're losing muscle too. Some studies suggest that up to 40% of the weight you lose could be lean body mass. Why does this matter? Because muscle is what keeps your metabolism running. It's what keeps you strong and functional as you age. Losing too much muscle can lead to something called sarcopenia, which is basically muscle wasting, and nobody wants that. The good news? You can prevent it. Here's how. Protein. You need to eat 25 to 30 grams of protein per meal, minimum. Chicken, fish, eggs, Greek yogurt, protein shakes, whatever works for you. High protein intake is non-negotiable if you want to protect your muscle. Resistance training, lift weights, do body weight exercises, resistance bands, anything that challenges your muscles. The research is crystal clear. People who combine these medications with strength training maintain much more muscle mass. And honestly, this is where that success checklist I mentioned earlier can really help you out. It breaks down exactly how to structure your meals and exercise routine to maximize fat loss while protecting your muscle. All right, let's address the elephant in the room. What happens if you stop taking the medication? The clinical trials painted a pretty grim picture. People who lost 20 or 30 pounds in the trial gained most of it back within a year of stopping. That scared a lot of people. It made it sound like you'd be on these medications forever. But here's the surprising part. Real-world data from 2025 shows something different. When researchers followed people who stopped taking semaglutide or tirzepatide in real-world settings, they did not see the rapid weight regain that happened in clinical trials. Why? Well, there are a few theories. First, real-world patients typically lost less weight to begin with. If you lost 15 pounds instead of 50, there's less to gain back. Second, unlike clinical trial participants who had the medication suddenly withdrawn, real-world patients often transitioned to other strategies. They switched to older weight loss medications. They paused and then restarted. They doubled down on diet and exercise. They didn't just stop and go back to their old habits. And third, many people use these medications as a jumpstart. They lose the initial weight, they build better habits, and then they maintain through lifestyle changes. Now, I'm not saying you should plan to stop or stay on it. That's something to talk to your doctor about. But if circumstances force you to stop, it's not game over. You have options. Let's talk about the long game. Because here's where the numbers get really interesting. About 50% of people make it through the first year on these medications. That's half. By year 2, only about 15 to 24% are still taking them consistently. Now, that might sound discouraging, but think about it differently. Those persistence rates are actually similar to other chronic medications. People start and stop diabetes medications. They go on and off blood pressure pills. Consistency is hard for everyone, especially when cost and side effects are in play. But here's the thing. Even if you're only on these medications for 6 months or a year, that can be enough to create meaningful change. Lose 20 pounds, get your blood sugar under control, reduce your sleep apnea, take pressure off your joints. Those benefits don't disappear the day you stop the medication, especially if you've built sustainable habits. And the future is actually looking really bright for people who need these medications. Generic versions of semaglutide are expected to hit the market in 2026. That could drop the price significantly. Oral versions are coming too. Wegovy in a pill form, a medication called orforglipron that you take daily instead of weekly injections, and it might cost as little as $149 a month. New medications are in development that combine weight loss with muscle preservation. There's even talk of once-monthly injections instead of weekly. The point is, this space is evolving fast. If cost or convenience is your barrier today, it might not be in a year or two. Now, I do want to mention one more thing. A study from early 2026 compared these medications to bariatric surgery, and surgery still wins by a landslide. People who had gastric sleeve or bypass surgery lost about 58 pounds over 2 years. That's 24% of their body weight. People on semaglutide or tirzepatide lost about 12 pounds on average. But here's the context. Most of those medication users weren't on the full dose for the full 2 years. The ones who stayed adherent lost much more. And surgery comes with risks, recovery time, and permanent changes to your digestive system. For some people, it's the right call. For others, medications are a better fit. So what's the bottom line here? These medications work. Semaglutide, tirzepatide, all of them. They really do help people lose weight, but they're not magic pills. They're tools. And like any tool, you get the best results when you use them correctly and consistently. Eat enough protein, lift weights, stay on the right dose for your body. Work with your doctor, and if cost is an issue, explore telehealth options, patient assistance programs, and compounded versions where they're safe and legal. If you haven't already, grab that free success checklist I mentioned. It's got meal planning tips and strategies to help you be in that group of people who get clinical trial level results in the real world. You've got this. And remember, even a 7 or 8% weight loss can transform your health. Lower blood pressure, better blood sugar, less joint pain, more energy. That's real. That's worth celebrating. If you'd like even more information on how to get the best weight loss results, check out this video next. It will explain how to reduce loose skin while you're transforming your body. No matter where you are on your journey, these skin-saving tips will certainly help. Thanks for listening. I'll see you in the next episode.
Smarter Nut Nutrition.